Diabetes is a serious condition where your blood glucose level is too high. It can happen when your body doesn't produce enough insulin, or the insulin it produces isn't effective, or when your body can't produce any insulin at all. There are two main types of diabetes. We have the type 1 diabetes and type 2 diabetes. When you've got type 1 diabetes, you can't make any insulin at all. If you've got type 2 diabetes, which is the most common, it's a bit different. The insulin you make either can't work effectively or can't produce enough. They are different conditions, but they are both serious. There are lots of other types of diabetes, and they include gestational diabetes, which some women may go on to develop during pregnancy, type 3C, moody and latent autoimmune diabetes in adults. In all types of diabetes, glucose can't get into your cells properly, so it begins to build up in your blood, and too much glucose in your blood can cause a lot of different problems. To begin with, it may lead to diabetes symptoms. The causes of diabetes depend on the type. What all types of diabetes have in common is that they causes people to have too much glucose or sugar in their blood. But we all need some glucose. It is what gives us energy. We get glucose when our bodies break down the carbohydrates that we eat or drink, and that glucose is released into our blood. We also need a hormone called insulin. It is made by our pancreas, and it is insulin that allows the glucose in our blood to enter our cells and fuel our body. If you don't have diabetes, your pancreas senses when your glucose has entered your bloodstream and releases the right amount of insulin so the glucose can get into your cells. But if you have diabetes, this system doesn't work. The symptoms can depend on the type of diabetes you have, but the common symptoms of diabetes include going to the toilet a lot, especially at night, being really thirsty, feeling more tired than usual, losing weight without trying to, general itchy or thrush, hurts and wounds take longer to heal, blood visions. A lot of things can affect blood sugar, so it can be tricky to balance. But it is possible to lead a full life. It's about being tuned with your body and learning what works for you. Over a long period of time, high glucose levels in your blood can cause problems in almost every part of your body, from your brain to your feet, and can seriously damage your heart, your feet, and your kidneys. These are known as complications of diabetes, but with the right treatment and care, people can live a healthy life, and there is much less risk that someone will experience these complications. It's Health Talk for a better welfare.